A Baker's cyst, also known as a popliteal cyst, is a fluid-filled swelling that develops behind the knee, typically caused by the leakage of synovial fluid from the knee joint into the popliteal space. On ultrasound, Baker's cysts typically appear as anechoic, dark areas with well-defined borders. Here are the key features of a Baker's cyst on ultrasound. 1. Location. It is seen in the popliteal fossa, which is the area behind the knee joint. 2. Shape. Typically ovoid or rounded in shape, with a smooth or lobulated contour. 3. Anechoic content. The cyst is generally anechoic, dark, which is characteristic of a fluid-filled structure. 3. However, it may show hypoechoic areas if there's internal debris or hemorrhage. 4. Posterior compression. On dynamic imaging, compressing the cyst can show a reduction in size, which can help differentiate it from solid masses. 5. Associated findings. In some cases, there might be evidence of joint abnormalities, such as degenerative changes, meniscal tears, or synovial effusion, which can contribute to the development of the cyst. 6. Size and wall thickness. The size of the cyst can vary. 6. If the cyst is large or has a thickened wall, it could indicate an inflammatory process or infection. In cases of rupture, a Baker's cyst may cause fluid leakage into the calf, which can be visualized as an anechoic or hypoechoic fluid collection, and it may cause pain and swelling in the lower